Hello, everyone. I'm Laura Bunker, co-founder of Family Policy Resource, and we promote life, family, and religious freedom at the Utah State Legislature, and I'm happy to be here today. Thank you so much to the Eagle Forum for giving us an opportunity to talk about the harms of assisted suicide. So again, we're on the life spectrum. This may be on the other end from what Marianne talked about. So we could talk about how assisted suicide puts elderly patients at risk for elder abuse, or how it is nearly impossible for even experienced doctors to be able to tell when someone is going to die. We could talk about how being alive means being vulnerable to pain and suffering, and we don't end suffering by ending the sufferer. But today I've chosen to focus on how assisted suicide hurts patient choice. What is doctor-assisted suicide or assisted suicide? First, let's clarify what it is not. Removing life support or withdrawing treatments that are postponing death is not assisted suicide. Virtually all medical professionals and all courts of law respect these decisions that families must make. That is not assisted suicide. Assisted suicide is when a doctor prescribes a lethal drug that a patient takes for the sole purpose of causing their own death, and that is the actual drug. The most commonly used drug is secobarbital. It is often used as a sedative before surgery in a dosage of 100 milligrams. For the lethal dose, 9,000 milligrams are used, or 90 capsules are opened up and stirred into pureed food or liquid and then consumed all at once. So 100 milligrams versus 9,000 milligrams. So you can tell assisted suicide is basically a drug overdose. Now, no one wants to suffer or wants their loved ones to suffer. So this idea of choice is very compelling. This is a photo that was used in the Deseret News. These are actual citizens who came last year to the legislature who were very sincere and very passionate about begging the legislatures to have this choice. The idea of choice is so compelling that in 2015, 63% of Utahns were in favor of assisted suicide legislation. The bill's sponsor, Representative Chavez Houck, who is bringing the bill back for the fourth year in a row this year to the 2018 legislative session, she sincerely believes that everyone should be able to make the choice about how they die. She stated, "The patient's agency should be respected above all else," unquote. Yet if the choice to die this way is so beneficial, then why did all of the assisted suicide bills in the United States fail last year? In all 24 states that brought it forward in 2017, the bill failed, including Oregon, where assisted suicide is legal. Their bill to expand it failed. Why did New York's highest court unanimously refuse to overturn their law prohibiting assisted suicide? And why did the American College of Physicians, with 152,000 medical professionals, take an official stance opposing assisted suicide? Well, there are many reasons. But one is because legaling assisted suicide undermines the important doctor-patient trust and also denies patients valuable medical treatments. First, let's talk about the importance of doctor-patient trust from a personal perspective. Last summer, I was diagnosed with cancer. It has been a difficult journey. But I have learned that even on a bad day, life is good. Even when it's hard to be alive, it's good to be alive. and I'm thankful now to be in recovery. But from the moment of my diagnosis, I was swept into a large and fast-moving system of doctors, nurses, surgeons, geneticists, and insurance professionals. They were all strangers to me, and yet my life was in their hands. What gave me the confidence to trust them is a shared, unspoken understanding that life is precious, but even more than that, that my life is precious. Every patient deserves to feel that from their medical team. Unfortunately, when assisted suicide laws passed, that trust breaks down. Dr. William Toffler testified to this fact in his video to the Maryland legislature. He is a professor of family medicine at Oregon Health and Science University in Portland, Oregon, where, of course, assisted suicide is legal. He has practiced medicine for 36 years and is opposed to assisted suicide for many reasons, including the loss of doctor-patient trust. So let's hear it in his own words. Oops. There we go. Somehow, let's pause that. Yeah. Thank you. It's right here, but it's showing.
It's going up.
Okay. Should I just try unplugging and plugging in again? Oh, there it goes.
Because two oncologists had given her different opinions. One was more optimistic, one was more pessimistic.
How come it goes away? That's funny. Okay, well, I could just put the microphone up to it. Okay, sorry.
About the motives underlying doctors.
Yeah, there we go. All right, thank you so much. Let's try this again.
Most problematic to me is the change in attitude and the distrust. One patient who wasn't even my patient, but knew of my stance publicly, called me up because two oncologists had given her different opinions. One was more optimistic, one was more pessimistic. She asked me, is one of the doctors a doctor with a pessimistic opinion? One of the, quote, death doctors? Such questions were never a part of the fabric of care in Oregon prior to the passage of assisted suicide. But the distrust among many patients in Oregon is profound about the motives underlying doctors. My concern also is for managed care. One of the largest managed care organizations in the state is the state itself, for Medicaid, for the underserved patients in our state. So they're denied sometimes pain medications that I want to give them, but they're given 100% coverage for assisted suicide.
That's right. So in addition to losing trust in their doctors, patients were also denied valuable treatments, including pain medications. In the Wall Street Journal, Dr. Toffler summed it up by saying, supporters claim assisted suicide gives patients choice. But what sort of a choice is it when life is expensive but death is free? Many of Dr. Toffler's patients do not have choice. Next, let's meet Dr. Brian Collister. He is an associate professor of internal medicine at the University of Nevada School of Medicine in Reno. A few months ago, the Washington Times reported that Dr. Collister said he tried to transfer two patients to California and Oregon, both states where assisted suicide is legal, for procedures not performed at his hospital. Let's see if we can hear Dr. Collister explain what happened.
I chose to become a physician
because I wanted to make a difference in people's lives. Recently, I had 2 different patients, and both needed life-saving procedures. When requesting a transfer to a center in their home states, one's in California, one's in Oregon, the insurance medical directors I spoke with said they would not cover the life-saving procedure that we'd requested. But hey, by the way, have you considered assisted suicide? Quite frankly, I was stunned. This is something we didn't talk about, we didn't request, we didn't ask for.
Interestingly, the Washington Times also reported that these patients were not terminal, but would have become terminal without the procedures. It was estimated that their chance for cure, not just adding time, was about 50% in one case and 70% in the other. So now you can see how this is getting fuzzy here on what's terminal or what's not. Yet these patients of Dr. Callister did not have choice and are both currently at risk for a death too soon. You may remember Stephanie Packer, a young mother in California. Let's hear her story again.
I am a wife and a mother of 4, and I've been diagnosed with a terminal illness. We've been trying to get me on a different chemotherapy drug for the infusions, and when the law was passed, a week later, I received a letter in the mail saying that they were going to deny coverage. They didn't want to pay the money for it. On my letter, it didn't say anything about physician-assisted suicide as far as, why they were denying me. So I called the insurance company and I was asking them why I didn't get approved for this drug. So I said, well, what about the drugs that they're using for the new law? This physician-assisted suicide, there are these pills that I could get. Would you cover that for me? She says, yes, we do provide that to our patients. You would only have to pay $1.20. In front of me, I had the validation that all my fears were correct. My doctor had appealed it. He appealed this decision twice, and they're still coming back saying no. As soon as this law was passed, patients fighting for a longer life end up getting denied treatment. Patients are going to die because of this.
Stephanie does not have choice either, and she is also facing a death too soon. So in summary, instead of giving patients more choices, legalizing assisted suicide takes away choices from patients by denying them valuable medical treatments and putting them at risk for death too soon. It also undermines the important doctor-patient trust, which is so critical for every patient in every stage of healthcare, from treatment to end-of-life comfort care. Every patient should feel that their life is valuable and that their doctor and their insurance company are on their side. In a way, we agree with Representative Chavez Houck that the patient's agency should be respected above everything else. We just believe it is the patient's agency to fight for a longer life that should be respected above everything else. This includes every patient, Dr. Toffler's patients, Dr. Callister's patients, patients like Stephanie Packer, and patients like me, and patients like you. That is why the state of Utah must not legalize assisted suicide. Thank you.